Patient is a 97-year-old female that suffered a ground level fall and takes Eliquis for her AFib. 2 nights ago, the patient suffered the fall while trying to pick something off the ground with a positive head strike. She did not seek medical attention at that time. Last night was her last known normal. This morning, her son found her on the ground unresponsive with left gaze deviation. She was transferred to an outside facility where a head CT was done that showed a large left subdural hematoma and a right traumatic subarachnoid with a small amount of interventricular hemorrhage. The patient was given factor 4 for the reversal of her Eliquis and then transferred to my facility. Neurosurgery was consulted on this patient but is non-surgical at this moment. Per the patient's son, the patient has been nonverbal throughout the day. Past medical history includes hyperlipidemia, hypertension, osteoarthritis, AFib. Past surgical history includes knee replacement, hip replacement. Medical history includes Eliquis. Family history: the patient's son is unaware of the patient's family medical history. Social history: before the fall, the patient was living independently at home, but remained in close contact with her adult son and adult daughter. She denies smoking, alcohol, and drug use. The patient has no known allergies. The review system was unable to be obtained from the patient due to her mental status, but per the son, was not have review systems with normal until the fall. Her vitals were all within normal limits. On exam, the patient is an elderly, frail female, resting comfortably in bed. She has large ecchymosis to the left orbital with a small lacerations. Lungs are clear bilaterally with normal respiratory effort, and she is protecting her airway. Her heart, S1 and S2 are heard with normal rate and rhythm, no murmurs or gallops. Abdomen soft, non-tender, no masses noted. Extremities are warm and well perfused, with palpable pulses in all 4 extremities and no edema. Neurologically, she does not follow commands, but eyes open spontaneously, and she tracks you across the room. She is still nonverbal. The left upper extremity is anti-gravity. The left upper extremity is not able to move against gravity. The left lower extremity does also not move against gravity, but they both withdraw to pain. The right upper and lower extremity are 5 out of 5 against resistance. Assessment: this patient has a left traumatic frontal subdural hematoma, a right traumatic subarachnoid with extension into the interventricular hemorrhage, and altered mental status. The plan for her is she will do Keppra 500 Q12 for BID. We'll repeat the CT scan in 6 hours and then 1 in the morning. Neurosurgery has already been consulted and have given us the recommendations. We'll keep her blood pressure less than 140. She is currently on cardine. We'll do Q1 hour neuro checks. Respiratory wise, she's currently protecting her airway, so we'll give her, she has no active issues there. And symptom spirometer will be the only plan there. CV, we're going to hold her Eliquis for now, monitor on telemetry, and obtain a 12-lead EKG. Renal, she has no active issues. We'll train urine output. We'll start on IV fluids, NS at 50. For GI, we'll keep her NPO until speech therapy can see this patient, and use Pepcid as her proton pump inhibitor prophylactically. We'll do no Lovenox, but hold. We'll do STDs for DVT prevention. IND, she has no active issues as her she's afebrile, and her all cell lines are clear. For endocrine, we'll check her blood sugars Q4 until we start a PO diet.